Hi everyone, welcome back to iMumz Ask Me Anything session. And today we have a very relevant topic and a very experienced doctor. So, without any further ado, I'll just introduce Dr. Pooja to you. She is a gynecologist, obstetrician who's been practicing for the past 12 years. She is from Chhattisgarh, Raipur. So she has her own clinic, does a lot of antenatal classes, and she's practically involved with all her patients throughout their pregnancy journey. So Dr. Pooja is really loved by her patients. So we hope she, you can make the best out of it. You can ask her all the doubts you have, and Dr. Pooja will also tell you, how you can reduce this COVID anxiety that you are facing currently, because as a pregnant mom, you must be really worried looking at the situation outside. Over to you, Dr. Pooja.
Yeah, hello, very good evening to all the ladies here. And really, we are in this pandemic, and many patients and general population all are in panic, and especially pregnant women, they are in very much anxious phase, fearful. So, what will I do? What will I do if I get pregnant and get infected in pregnancy? Or what is the benefit of getting vaccine? Or I should get it or not? So here I would like to say a quote. It is not the strongest of the species that survives, nor the most intelligent, but one the most responsive to change. That is, who are ready to change with the times. Like with COVID, we have learned a lot. We have learned to live at our home with minimalism and with emotional stability. So, with COVID, we have learned many things which we were not used to actually before this COVID era. So, I would like to share a story here. There is a jungle, and there was a deer who was pregnant. And you know that deer is a very social animal, they live in herd. So one day what happened, she was about to deliver that day, she got some pains, started the labor pains, and there was so much thunderstorm and lightning that the forest began a spark, and the forest began to fire in fire. So all the forest, it was in fire. All the animals were running here and there, and the deer got very panicked what to do. And she was separated from her herd, her near and dears who will take care of her. So she ran against the fire, and she ran towards the river. So at that time there came a hunter and that hunter, uh, he also targeted the deer. Then from the opposite side, tiger also came. So what should I do now? The deer was very much afraid, and she was like, now what should I do? I should focus on my delivery, or what should I do if I'll remain alive or not? What will be if I'm dead? What will happen? So all these confusing and fear, fright, all the emotions, they ran up to in her mind. Suddenly, what she thought, no, I am myself. I have to look after me. I have to look after my baby. So, this is the time I have to deliver, because that is the time where the baby will be in harm if I will not deliver her. So, she focused on her delivery and said ki, now God, it's all up to you. You save me. She surrendered to God. Suddenly what happened, that uh, the thunderstorm, because of thunderstorm, when the hunter shot on the deer, he got baffled, and the shot was missed for the deer, and that shot, the tiger was shot dead. Because of thunderstorm, the rain started, and the fire got vanished. The fire got all the settled down, and the the thunderstorm, that lightning, that killed the hunter also. So that is the situation, and the deer got relieved. She delivered her baby. She ran to the river and drank some water. She was calm. So after a storm, there is a calm. There, after a dark night, there will be a bright morning. And like there is, that is the rule. That is the rule of nature. So we don't have to be anxious. We don't have to be fearful. We just have to believe in ourselves, love ourselves. This is the time where you are pregnant and you have to nurture yourself also and your baby also. So, dealing with all this anxiety and stress, you have to keep one thing in mind for sure, that you're not alone. All people are fighting with this pandemic. And the best part, I'm saying the best part, because this is the best of COVID, what I feel, that in COVID we have to stay at our home only. Because like in other calamities, earthquake or flood, there is so much of destruction, so much of like it's a very destructive calamities are there. But fortunately, COVID's recovery period, its recovery rate are so much high. Only few patients need ICU admissions or oxygen, or very, very, very rarely death. Then, so you have to be very much, we can say, calm and confident about this situation. Take all the precautions and all the things so that you will not be in panic mode, and educate yourself. So for COVID, fear and anxiety, many people come, many patients come to us, doctor, what will I do now if I'll get infected? What will be the effect on my baby? What will be the effect on me? What will be the effect on my delivery? If the baby will get anything, congenital abnormalities will be there or not? What will happen? What will, where should I deliver? There are so many issues and questions in the patient's mind. So don't panic. The first thing is, don't panic. So to fight with this anxiety and stress, where when we are anxious, because why we are anxious, because we don't know the answer exactly when this pandemic will end, whether I be affected or not, whether I will recover or not, what will happen to my baby. So all these confusions are there. So first thing is, you have to be clear, you have to educate yourself, you have to update yourself, you have to refrain from the negative news. So the first thing which WHO and CDC guidelines, they have also mentioned to keep yourself calm and peaceful, is take care, take all the precautions, and refrain from all the negative news, all the rumors or arguments, or WhatsApp messages or social media messages, which are circulating some fake news also, and they are creating panic. They are denoting the number of deaths only. They are not denoting the number of recovered patients. So we have to think positively. I have written, I have made a chart where we have like it's a me time and we time. So me time, what does me? Me time stands for, हमें ये तो पता है कि what is me time. So we have to give time for yourself, ourselves, so that you and your baby will develop a good bond, and you will nourish nicely, and your baby's growth will be nice. So me time for me, me is me. M stands for meditation. M stands for mindfulness. M stands for mother and baby bonding together. M stands for music listening. So all these are very important. If you take time, like अभी आपको time मिल रहा है, if some patients are also getting infected by some or other exposure. So you have to utilize that time. And even if you're not infected, you're at home, you're at taking all the precautions. So you have to keep your stress, all your worries, all your keep all that aside. So you have to give some time for meditation, pranayam, at least 10 minutes. 10 minutes daily, if you will give some time for building your inner strength, inner engineering, कि आपको खुद को कितना strong होना है. You know, there are so many great leaders in history. If you will read about them, that Jiza Mata, she gave birth to Shivaji. When she was pregnant, there were so many like negative things going around her, but she was very confident and she was very strong from inside. That she took a mission, she took a oath that my son or my baby will take all this revenge, and Swaraj, he will bring all the Swaraj, and he will fight with all the Mughals, and he will keep all the people away from this British Mughal nation. So meditation, mindfulness, they all build a bond with your mind, body, and soul. And the most important thing is they connect you yourself with your baby stronger. So, and music listening. Obviously, meditation, while doing meditation and mindfulness activities or pranayam, if you will listen to the music or some relaxing music or some ragas, classical music, that will improve the baby's cognition, development, emotional development, the language skills. There are so many effects, positive effects on the baby if you will do all these activities daily for at least 10 minutes. 10 minutes meditation, 10 minutes pranayam, 10 minutes music listening, some nice story or some prayer or whatever you like. You have to go through all these things. Then comes the E. What does E stands for? E is for education, E is for exercise, E is for expressing gratitude and emotional feelings for others in your life, emotional stability, and building the resilience. You must have heard that this pandemic time, it's a time for your tasting. It's a time for tasting to fight this battle all together. So we are building this with the emotional. There are so many stresses, people's jobs, people's health conditions. There are some or other losses in the family, or there are someone who are admitted and they are not recovering. Whatever may be the reason, financial constraints, job insecurities. There are so many issues going on. So with for fighting with all this, you have to build a resilience. You have to take out the opportunities from this disguise. So you have to take like if you will get educated कि आपको you should know the basics of COVID, how it occurs, how to prevent it, when to vaccinate or not. Even in pregnancy nowadays, there are so many news coming up to vaccinate, but Government of India till now has not approved for vaccination in pregnancy and breastfeeding. So till that time, you have to keep all the precautions. Wear a mask, keep social distancing, avoid crowded places, avoid contact with any like crowded gatherings. So taking all these precautions, you have to maintain your emotional stability also, because if you're not used to staying at home, then it will be a complete lockdown for you. So you have to exercise. First is educate, second is exercise. What exercise do? Exercise under a guidance, under your doctor's guidance or physiotherapist guidance or expert prenatal educator, wherever you are there, if they are there, or you can take an online consultation with approval of your gynecologist. So you have to be get moving, because pregnancy is a 9 months journey and there are so many aches and pains in pregnancy. So you have to get through all that also. Beyond this emotional problems, you have to express gratitude early in the morning, just after waking up and before sleeping. You have to express gratitude, thanks to God that I am well, I am good enough, I'm taking care of my family, my baby. I'm healthy, I'm peaceful, I'm powerful soul. So all these thanks messages, they are definitely helping you in calming down. And the most important is express your feelings and connect with your family, friends. So this is all about the me time, which will build your positive energy, your glass of water. Like whatever you have, you will serve to others. So in COVID pandemic, many have come up for helping others, and that is the real satisfaction. Not just the frontline workers, but the people around us, they are also doing a great job helping others who are COVID patients or who need some assistance, medicines, oxygen concentrators, or plasma, whatever. There are so many people who are having all these activities doing and helping others. So you can also do that so that you will feel good, and the baby will also get a positive message. Then there is a V time. First you have to empower yourself, and then we time. So first one is hobby cultivation. अभी तक आपने ऐसा कुछ सोचा नहीं होगा कि what is your hobby, or you have not done anything. You can do drawing, you can do craft, you can do anything, painting, or whatever. It's online classes, you can update yourself, you can take a course, you can update your job skills, whatever. You can do any craft work, like anything you can start doing that. That will make you in a state of flow, and that will make you mindful also, because that will get away all the stress, and you will be in the present, you will get into the flow of the activity. Gardening you can do, you can walk in nature, whatever you like. You can play games with kids. That is the most important thing, and it makes you so happy, and you forget all your worries, and the kids are so innocent, playful, happy. So by just seeing them, we get a smile. So if you are with them, definitely you will feel very much good. Again comes the point is sleep hygiene. Sleep hygiene, you have to take a regular sleep. You wake up at one time. If you are in a period of isolation, if you are lonely, then also you have to maintain the daily time schedule of waking up, going to bed, and keeping away all the gadgets in night, and or taking care of yourself, your baby, and doing all the activities routinely, walking in between, like all these things. Family and friend support, it is very must during this time. You can connect online, like online, the net, the surfer is very much necessary nowadays, because that is the only medium to connect, because all are at their home. We can play games online, we can connect, we can do video meetings, we can do FaceTime. So face to face connection, it is the most important vitamin with what we are getting, and that will create antibodies also, as we have seen all in many messages, that family friend support is must for getting emotional recovery. But we have to reframe our thoughts. Like if you are very much concerned about COVID, okay, what if I get COVID, what if I get isolated in a room or in hospital, what will I do? So you have to reframe this situation, like reframe all these thoughts. You have to think like this: oh, I will get so much of time with my baby, I will talk to my baby, I will sing a song, I will sing a prayer, I will teach him like this. Whatever thoughts you are getting, negative thoughts, you have to reframe them in a positive way. Maybe it's not real, but you have to think like that. So many a times, just by thinking and dispelling all these negative thoughts, you are much better. And you have to take deep breaths in and out, like in pregnancy, pranayam you can do, so that your all the negative thoughts, they will disappear slowly. And the most important thing is get in touch your be in touch with your doctor. So if you are consulting a doctor or whosoever is your consulting doctor, you have to be in touch with them. You can do online consultation. You can get checked by COVID OPD or COVID hospitals, whosoever are doing at your place. You have to be in touch with them, get checked, or online consult, or if the time of delivery is near, so you can be in touch with them, and if there is any problem you can go there. And all the COVID hospitals, they are doing a great job, and they are working day in and day out for you, and they are taking very great care for yourself. So you have to, like abhi jaise we have all talked, so to devote your time to productive activities. Don't 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 give any attention to negative news. Just a 5 minutes or 10 minutes online will give you all the updates. There should not be like कि बहुत ज़्यादा देर आप net देख रहे हो या news देख रहे हो, and you will get all the negative information more to उससे you will be at more in the negative phase, and the subconscious mind, you will be restless and fearful or anxious. You should think about giving support to others or helping others, or talking to others. Be happy, be relaxed, be stress free. Think about your baby. You have so powerful angel with you, and think about the baby, and do some work, do some logical reasoning questions, maths activities, puzzles, drawing, painting, any left brain activities or right brain activities, whatever you like. You can do all these things to improve the IQ, PQ, SQ, and EQ of your baby. You can listen to the stories. You can talk to the baby, what we call as Garbh Sanskar. So there are so many things which we can do, and actually utilize this time to a very positive thing, so that the baby will be also emotionally powerful and resilient. So uh, I think if we can take the questions.
Sure, sure, ma'am. Definitely. Thank you so much for that positive talk. I think it is much needed in these difficult times. So I'll take up the questions related to COVID first. So please do not mind if I'm missing your questions. We'll take them up later. Mansa is asking, hi ma'am, I'm 21 weeks pregnant and COVID positive. Fever is not reducing and my physician suggested to take Medrol 4 mg. Is it safe to use?
Yeah, Medrol is methylprednisolone, and or prednisolone, whatever steroids. What I understand by this 4 mg. So you can very well take this, and it is very much safe in pregnancy. And if the fever is not going down, or if it is intermittently coming again back and relieving and again spiking up, so you have to take all the medicines for fever also, antibiotics also, and whatever the doctor is suggesting to you, steroids also. They are very much safe.
Thank you, ma'am. Ma'am, Gunjan is asking, I'm 24 weeks pregnant. What to do if the family member is COVID positive? What are the precautions that should be taken? And should I be taking my vaccine?
Yeah, if you are not yet your report is negative, what I understand by this, your family members are positive, no?
Correct, ma'am.
Yeah. So you have to isolate yourself or isolate them in a room, or if not in another room or hospital, and you have to be maintaining all the precautions, all the things like wearing mask, and taking all the precautions like social distancing. Don't use anything whatever is used by them, any utensils or clothes. You have to sanitize the space, and you have to maintain your hydration. You can take the steam inhalation twice a day, and you can take warm water, or you can take mm, you can do breathing exercises to maintain your power in emotional stability also, and inner power to uh, be a fighter, and you should not take the infection up to you. And regarding vaccination, uh, like I said earlier also, because vaccines are very much safe for pregnancy and breastfeeding women, but in India they have not, we have not done any trial yet with Covaxin or Covishield, but so Government of India has not approved till today. Maybe in future they will do some trials and then approve that, then you can take vaccines. Till that time you have to do all the COVID appropriate behavior, and precaution is the best, prevention is the best policy.
Absolutely, ma'am. Uh, Jiva is saying, I'm a working woman and I'm worried to go to work because I'm working in a bank front office. I'm 20 weeks pregnant. What do you suggest?
Okay, so you are at the front office, means you are getting exposed to so many people. So you can 21 weeks means you have to get vaccinated for other diseases. You have to get in touch with your doctor, get all the things, sonographies and all the things you have to do. You have to take all the balanced diet, hydration, and the best, like the most important part is this all do the all the precautions, especially masking. You can use face shield if you're at the front office, and you can take steam, or you can do breathing exercises so that your lungs will be more resilient to infections. You can cut down your timing of the, like at the front office if possible. Then you can do 4 hours, or partially you can do some back office work also if your office permits for that. You can take some rest, maintain hydration, avoid crowding if possible, avoid crowding, or you can maintain the like whatever clients are coming to you, you can maintain their social distancing there, and keep be one by one, keep their entries and keep them informed. If they have any problem, they can inform you.
Thank you, ma'am. Ma'am, Christabel is asking, I'm in my 17th week of pregnancy. Would you suggest any vitamin C supplements to improve immunity or to increase the immunity?
Yeah, vitamin C we are giving actually after infection. But to improve your immunity, there are so many dietary modifications you can do. You can include the citrus fruits in your diet. You can increase your water intake. You can take a balanced diet. You can improve the protein intake. You can take a sun bath or some vitamin D supplements. So all these things you can do prophylactically. But just for prevention, vitamin C will not work. It will, all the precautions only will work. Vitamin C we generally give after infections. You can take some multivitamins, but not just vitamin C.
Thank you, ma'am. Ma'am, Bindu is saying, I'm 22 weeks pregnant and yesterday has been my scan day. I'm having a little bit of headache and throat itching. This is my regular symptoms for my wheezing to start, but still I'm a little worried. Can I take Dolo if I get fever or for my headache? Please suggest.
Yeah, you can take the medicine Dolo, that is a paracetamol. So it is very much safe in pregnancy. But before that, you should take some hot water, or ginger, or steam and saline gargles that will get rid of your itching and the itchy throat also.
Thank you, ma'am. Tejaswi is saying, I'm a frontline health worker and I tested positive for COVID-19. It's my 27th week of pregnancy and my CRP level is increased. Please suggest what can I do?
How much week she is pregnant?
She's 27 weeks pregnant right now.
And tested positive. Okay, so you are in home isolation. or what, like she has to consult her doctor, her physician, and we have to see all the other parameters also, if her saturation SpO2 level is maintaining or not, she's having fever or cough or breathlessness, what are her symptoms. And just by CRP we are not doing anything. We are giving all the protocol, like the treatment according to protocol, antibiotics and supplements. But if she is having any other problem, then she has to consult and get admitted at hospital.
Thank you, ma'am. Ma'am, Sindhu is saying, I tested positive for COVID-19 in the 22nd week. My my CTRC, RT-PCR was 13. I was not given any medication other than vitamin supplements. Will this high viral load have any impact on the baby's health or my health? Uh, Probability of reinfection is lower.
Actually, you are 16 weeks, so I don't think you will develop antibodies soon, and that will pass on to your
No,
baby also.
no, 22nd week.
22nd. So the CT value is 16. So that is not very high and that is not very low also. It is midway. So you have to take all the precautions, take all the care, and see antibiotics and all the higher things, they are not given for asymptomatic patients. So the treatment is perfect for your symptoms. So just be in isolation period, utilize your time, be positive, be happy, and be relaxed. The infection will go away, and complete your isolation period if you are not having any symptoms like fever or breathlessness or cough. So there is no need, and the baby will be safe. The antibodies will form soon after, like 15 days, they start forming. So your baby will get all the benefits of your antibodies.
Thank you, ma'am. The next question is from Megha. I'm 14 weeks pregnant. I tested positive for COVID. Today is the seventh day of my symptoms. I am unable to do breathing exercises as suggested by you because I have severe cough and chest discomfort. Please suggest what can I do and some easy breathing practices.
See, if you cannot breathe nicely, then definitely you have to test for all the vitals, temperature and SpO2 monitoring twice or thrice daily, or whenever you are not feeling well. So if it is maintaining, like SpO2 is maintaining, then you can take steam and gargle, so that you will take all the breathing properly, and slowly you have to breathe. It is not necessary that you have to haste. You can do you can consult your doctor there for examination, because it should not be like that ki we are seeing ki kuch hai nahi, and in the inner side there may be some problem. So it's always better to be in touch with your doctor, and if you're not feeling well, or if you're not able to breathe nicely, then definitely you should consult your doctor first.
Thank you, ma'am. I think that is helpful for her. Moving on to the next question here. I think you had suggested that from which month our activities help the baby's IQ to grow. I think you had asked them to do some activities. So Meenakshi has this question, and I thought you would like to answer this.
Actually, this is very much vague, because see, 80% of the baby's brain develops in the womb only. So whenever you are aware of the things, whenever you are aware of the, like we can do such kind of activities, that time only you have to start. There is no such rule thumb rule कि आपको first month से ही करना है और second month से ही करना है तो ही होगा. It is not like that. Even before pregnancy, if you're following a good diet, a balanced diet, exercise and all the things properly, then also it helps a lot. But during pregnancy there is no such time. As early as possible, whenever you are aware of the things, you can start these activities. It will benefit a lot.
Thank you, ma'am. Ma'am, Mokshi is saying, "Hi, doctor. My seventh month started on 10th May. My gynecologist prescribed EcoSpring, protein powder, iron, and calcium tablets. I had first dose yesterday, and today I noticed brownish and pinkish spotting on my panty. Could you please suggest what should I do now?"
First dose of what?
Uh,
Medic.
EcoSpring, protein powder, iron, and calcium.
With EcoSpring, generally the thing spotting doesn't occur in one dose. Maybe there may be some other reason or infection or some discharge. So that you have to take care and consult your gynec for the reason for this spotting. Because single dose cannot have this kind of presentation. So definitely there can be another reason of any discharge or infection or some bleeding if it is there. So we have to find out the reason for bleeding. I hope I answered your question.
Yes. Thank you, ma'am. Uh, Moving on to the next question here. Okay, so yeah, Mokshi also had mentioned I didn't carry anything heavy, keeping things too light and doing a little bit of morning walk and sometimes in the evening, eating proper diet. I'm scared as I wasn't expecting this. I'm taking proper care. I think it's better she just visits her doctor, right?
Actually, yeah, yeah.
Thank you, ma'am. Ma'am, Nikita has a similar question here. This is my first month of pregnancy, and regularly I'm noticing a brown discharge. Is this normal?
Yeah, there is some increase in secretions in pregnancy because of the increased activity of the glands down. So there can be some discharge, but if it is occurring daily or if it is foul smelling, if it is bothering you, then definitely you have to see your doctor. And if it if they see and find it infectious or some abnormal discharge, then they can suggest you antibiotics or antifungal pessaries also locally, which can be inserted and the infection will be taken care of. Otherwise you can do some daily hygiene things, you can use some washes or you can use some probiotics for dealing with all these discharges.
Thank you, ma'am. Ma'am, Spandana has a question for you. I'm 26th week pregnant. I have a doctor's appointment day after tomorrow. Is it compulsory to meet the doctor directly, or can I consult on the phone? Is it okay? Any important scanning or blood test in this week? I need your suggestion.
See, you're 26 now, Spandana. So there is no as such thing, because if you're done with your anomaly scan, I think it must be done around 18 to 20 weeks of gestation. And the first dose of vaccine also may be done for you. So there is nothing specific at 26 weeks. If your weight and all the sugar tests are normal, then you can definitely consult your doctor online and she can guide you. And depending on your previous history, if you're taking some other medicines, then she can look after that and guide you properly. Because if I know this much history, there is nothing specific at 26 weeks to be done urgently.
Thank you, ma'am. The next question is by Orpita. Orpita is asking, I'm in the 20th week of pregnancy, but I cannot feel the baby movements yet. Uh, Sometimes I feel a little bit of tightness in the tummy, but nothing apart from that. Is it normal?
She's, I think, first time pregnant. Had she mentioned that?
No, no, she has not mentioned that, ma'am.
Generally, in first time, if in first time pregnant woman, they don't feel the moment till around 22 weeks. After 20 weeks, they may have some bubbling or something like going on in the tummy down there, but they don't understand that this is the feeling of movement. So by the time, by 15 days or so, she will have some proper feelings, and then she will understand that the feeling she had earlier was moment only. So just have patience, be relaxed, listen to some music or eat some of your favorite food and think about your baby, lie down and relax, and maybe you will feel more about your baby.
Thank you, ma'am. Ma'am, Gautami wants to know when can she start drinking coconut water daily and for how many months can she drink? So I think she's in the seventh week right now.
Coconut water is just right for everyone at every period of gestation. There is nothing that we should avoid it at any period of gestation, because it is very much rich in minerals and hydration and all the new electrolytes. It is full of electrolytes. So if you take it, it will definitely help you in relieving your nausea and vomiting if it is occurring. And there is no season also, even in winters people take it and there is no problem. So now it's summer only, so you can definitely take it daily.
Thank you, ma'am. Uh, Anjum is saying, I'm 7 weeks pregnant and I'm facing back pain, especially in the night. Can you please help me?
7 weeks.
Yes, ma'am.
Hello. Yeah.
7 weeks.
Yeah, so it's too early to have backache since this time. Maybe you are having it before pregnancy or some issues before pregnancy. So backache is the main complaint throughout pregnancy, and it increases with the increase in gestation. Like in seventh, 8 month, it progresses to very high severity. So you are having this from so early, so you have to definitely consult your doctor or physiotherapist, do some exercises, see the reason, whether if you are walking, see the posture, how you are sitting, or if you need any gels or local application creams you can apply. And the basic thing is exercise. You have to see for the cause and do back muscle strengthening exercises, take high protein diet, see for your posture, maintain your posture right while sitting or while doing any work or whatever you're doing. You have to keep your posture right so that it will not increase with increase in pregnancy gestation, because pregnancy is much more prone to backache because of the increasing baby weight and alignment of your spine. So you have to consult your physiotherapist and start exercising, and that will take care of the backache.
Thank you, ma'am. The next question here is by Rashmi. She's saying, I'm feeling acute pain in my upper abdomen in my 35th week. Please suggest.
35th week and upper abdominal pain. The most common reason is acidity, or because of the bump pressure on abdomen. You may have some uneasy feeling or breathlessness. So just take some walk or take some antacids, and don't lie down just after eating. You have to take some pillows to keep your head up, so that the all the things, all the whatever you have eaten, it will not regurgitate. So the basic thing is you have to take small frequent meals, lie down with a pillow with head up, propped up position, and take walks. Take antacids if it is not relieved with all these precautions, and if it is not relieved with all the antacids also, then consult your doctor.
Thank you, ma'am. The next question I see here is from Geeta. She says, I'm a little scared with my TSH report. It is just 0.10 and I'm 9 weeks pregnant. But the doctor gave me PTU tablet 100 mg twice a day. One of my known told me that the medicine is given in hyperthyroidism, but I have hypothyroidism. So please suggest, is the medicine prescribed correct or wrong?
See, TSH 0.1 is low, so you have to go for the free T3 and free T4 levels. And if you're taking some medicines, like you said, you are a case of hypothyroidism, and if you're taking medicines earlier for thyroid issue, then you have to see for the dosages, and maybe you have to cut down on that. And if you're not taking any medicines for thyroid, then you have to go for some further tests like free T3, free T4, and TPO antibodies and all, so that PTU is definitely given for hyperthyroidism. But if you are confused, then again meet your doctor, get all your queries done, get all the tests done, and then start with the medicines as per their advice. Point one is low, that suggests hyperthyroidism.
So the medication given right now is wrong, right?
No, no, it is right. But
Okay,
she
that's
said that
correct.
that is correct for her present report. But if she is
Okay,
saying it is a case of hypothyroidism, and if
okay,
she is taking some medicines for that, maybe then we have to reduce that dosages for whatever she is taking thyroid medicines. So
okay. So
I don't.
probably the doctor has given the correct medicine. She just needs
Yeah,
to cross check now. Okay.
yeah, cross check and take the test, more of the test done.
Thank you, ma'am. Ma'am, somebody is asking, how can I know my blood pressure is normal without getting checked? I feel scared to go out and check it. My uric acid level is 8. What should I do to normalize it?
In pregnancy.
Yes.
See, uric acid 8 is generally, it is like it is not there in this range. So definitely there is something wrong with this, and you have to get consulted. And blood pressure, there is no as such thing what you can do at home and check it arbitrarily, or matlab andaz we cannot do it approximately. You have to check it, and there is no other way around, because if you don't have like giddiness or uneasiness, it can happen. Lightheadedness, it can happen in low blood pressure also, or you can have some problems if the blood pressure shoots also. So uric acid 8 is not normal at all. So check with your doctor, and check with your doctor for blood pressure also. You can some blood pressure monitors are at home also, but there is some variation of 10 of Hg, so it is always better to consult and get all your queries solved.
Uh, okay, Meenakshi also has a question for brown discharge. So she says, I'm 13th week pregnant and I see brown discharge once in 2 days since 1 week. Is this normal, as my cervical examination shows everything is normal?
Yeah, like what we have already discussed, that the in pregnancy discharge can occur, and if you're not having it daily, or if it is not any foul smelling, then and you have checked it also, so the cervix condition is also normal. So just don't worry about it. Take some probiotics or curd or buttermilk or any probiotic supplements, and that will be all right for you. Nothing to worry.
Thank you, ma'am. Um, so Jasna is saying, I'm 18 weeks pregnant and now I am in UAE. I wish to go to India before my 7th month. Is it safe to go to India or should I stay back?
See, it all depends on your preferences basically, because in India now the situation of COVID pandemic, it is there. So how long it will be there, that I don't know. So maybe you have to further check after a month or so, and whenever you want to come here, definitely you can come. There is no we are not saying no, you can come to your family, obviously. Then just take all the precautions and let the second wave settle down here, so that by that time you can be there and see the things how it goes. So
Thank you, ma'am. Ma'am, Amulya is asking a question here. I'm in the 20th week and tested positive 15 days back. Symptoms are there from 21 days. There is a little bit of cough formation every morning. Is there a chance to get test positive again, as my gynecologist told me to visit after testing negative?
Actually, see, nowadays there are no guidelines as such for retesting. But if you have completed your isolation period and if you're not having any fever, then you can definitely, like, isolation is over, and you can visit your gynec after 17 days. So there is no need, means there is no recommendation actually for retesting. So if you are about to deliver, or if there is any procedure due for you for to be done, then maybe we can do test. Otherwise, for general checkup, there is no, or after recovery, nowadays there are no recommendations for retesting.
Thank you, ma'am. Ma'am, Sonam is 8 weeks pregnant and taking Dufoston, Sustain, and Sysfol active medicine. But my doctor has not prescribed any calcium or iron supplements. Can you please guide from which month are these started?
She's 28 weeks.
No, no, she's 8 weeks.
8 weeks. Okay. So 8 weeks is too early to start with this iron and calcium. You will get that medicines from your fourth month, nearly around 13, 14 weeks after your NT scan is done and your third month checkup is done. From fourth month, generally we start with iron and calcium and all the supplements and protein supplements. So right now you have to take all these medicines for 1 month altogether more.
Thank you, ma'am. Ma'am, Jyoti is saying, after COVID, when does antibody start developing? Until when does it work?
Yeah, antibody starts developing after your infection, generally after around 15 days. IgM antibodies first form, and then within a month, IgG starts forming. So, according to the data which is available, we cannot assure that the antibodies will remain for how many months, but for vaccination purpose, like what they are recommending, if you have got an infection, so you need not take the vaccine till 3 months, like 90 days. So maybe the antibodies will be remaining after that also, but we don't have any specific time that for all that it will remain up to 1 year or lifetime or 3 months or 6 months. We don't know. It is very much individual response of your body. So we exactly don't know how it will, like, how many months it will be there or not.
Thank you, ma'am. Ma'am, I think they would prefer this answer in Hindi. Shiv Das, his wife, I think, is 20 weeks pregnant right now. But when she was 16 weeks pregnant, she was COVID positive. Now she wants to know कि बच्चे को कोई problem होगा क्या future में because she had COVID.
See, right now, as we said, there is no at such problems. There are some cases of miscarriages or preterm labor because of this infection or fever. सो शी इज नाउ, अभी वो 1 महीना तो उनको हो ही गया है नाउ, अभी वो 16 वीक से 20 वीक्स तक तो आ ही गए हैं. सो अभी आप सोनोग्राफी करवा लीजिए. आपको सोनोग्राफी में आपकी बेबी की ग्रोथ की डिटेल्स पता चल जाएगी. एनिमली स्कैन इज ड्यू फॉर यू. सो एनिमली स्कैन में आपको अपने बेबी के बारे में पता चल जाएगा. और ऐसे कोविड इन्फेक्शन की वजह से आपकी बेबी को कोई भी हार्म होने की संभावना नहीं है. बहुत ही कम चांस है कि कोई मिसकैरेज या जल्दी डिलीवरी होने का चांस हो सकता है. बट ऐसा नहीं है कि आपको इन्फेक्शन हुआ है तो अब ये तकलीफ होगी ही होगी बेबी को. जनरली मेजॉरिटी ऑफ केसेस में कोई भी प्रॉब्लम नहीं होती है, एंड बोथ मदर एंड बेबी रिकवर वेरी वेल.
Thank you, ma'am. Ma'am, Ravi Kiran, I think, has posted a question for his wife. I'm 7 months pregnant, tested positive for COVID and consulted my gynecologist and using antibiotics, vitamins, calcium, medicines. And as I have cough and cold, loss of smell, and after 4 days of testing positive, I was able to sense smell No cold, only little cough. I was worried to be using so many medicines as I'm feeling very a lot of heat in the body. Does this medicine affect the body in any way? The COVID medications that they prescribe?
Not exactly, because all the medicines which are prescribed for a pregnant woman, they really take care ki, what is safe for her and what is not. So you should not worry about that. If you have taken it from your doctor, then but don't self-medicate. Don't self-medicate in the sense that don't do take or add on the medicines on your own. Just take check get checked all the medicines with your doctor, and there is nothing at such heat or what. If she is having any fever, then you can find some heat. If there can be some weakness after COVID infection, so at such the medicines are very much safe and they are given according to the pregnancy. Some medicines are to be avoided during pregnancy, so your doctor must have taken care of that, so no worries.
Thank you, ma'am. They also have another doubt. What kind of foods that I can take? Please suggest liquids and everything. What can I take? My doctor suggested me not to take fruits, non-vegetarian food, and only take proteins. So, what do you suggest?
Actually, you have to take all the things, balanced diet you have to take plenty of liquids, you have to take plenty of salads or juices or soups. You can take vegetable soups, so that it will enhance your immunity, and it will hot things you should prefer, not colder one, or packets or tinned juices. You have to take fresh fruit juice. You can take fruits also. There is nothing no about that. And the thing is, just go natural and take a balanced diet. It is not like कि सिर्फ प्रोटीन ही खाना है या सिर्फ कार्ब्स ही खाना है या सिर्फ ऐसे ही खाना है. आपको सब कुछ खाना है, जो भी आपको अच्छा लगता है. You can take that. Just see that you are taking mix of all vegetables also, fruits also, dry fruits also, liquids also. So maintain hydration and take steam.
Thank you, ma'am. Ma'am, Hema is asking, is there any scan that needs to be done in the seventh month? Also, can I take iron tablet 1 hour before dinner? Because after dinner, I take milk with protein powder.
Yeah, 27 weeks you said, no?
1 second, ma'am. She is in the 26th week.
Yeah. So after anomaly scan, which is done at 18 to 20 weeks, there is no actually, if that was normal, then there is nothing specific at this point of gestation. You can do sonography just to check if you want to check for your baby's growth. That can be done after 28 or 32 weeks also. So there is nothing specific. And another question, what she asked was,
She wants
I
to know
forgot.
if she can take iron tablet 1 hour before dinner.
Yeah, definitely. You can take it if you don't have any problem with that empty stomach, because iron tablets ideally should be taken empty stomach, and they get best absorbed if they are taken empty stomach. So there is no problem if you are very much comfortable with that routine. There is no problem. That is the ideal time.
Thank you, ma'am. Uh, Renu also has a question regarding the CT value of her COVID test being 28. So, will this affect my baby? But as ma'am said, there is no research done. So, there's not much that we can say, right, ma'am? Also,
CT,
related to
yeah.
this, Isha also has a question. I'm 2 months pregnant, and while I was COVID positive, I had done CT scan twice. Will this affect my baby's growth, or is there any risk?
CT scan is done if it is very much necessary for you, and if it is done like covering the abdomen with the lead apron, then we have to see the benefits versus risk in pregnancy. If you're having some problem and the doctor wants to see how much the chest is involved, or if there is anything suspicious, then you can go for CT scan. But actually, there are no guidelines to contraindicate CT scan, though they are not done routinely in pregnancy. But with COVID, guidelines have said X-ray and CT scan can be done with shielding. So you have to keep a watch on of your baby, and after delivery you can come to know कि वैसे कुछ होगा नहीं. Don't worry about that. Be relaxed. Nothing will happen.
Thank you, ma'am. Jyoti is saying I'm having a lot of hip pain, especially in the morning. Would you suggest the same, some exercise and physiotherapy?
Uh, Yeah, hip pain generally because of any because so early in pregnancy, if they're having such aches and pains, maybe they're having some issues or postural issues, or they're not doing some exercises, then they have to start with that and relieve that pains with some physiotherapy first, and then start doing exercises slowly according to their routine or schedule or what they like and not. So definitely for the hip pain, she has to undergo treatment and consultation, and afterwards she can resume her activities and see for the reason for hip pain, if there is any exertion or any other activity which is responsible for this pain, so she should avoid that.
Thank you, ma'am. Rupali has a question here. Which are the fruits to avoid during pregnancy?
Actually, only theoretically only papaya we don't recommend. Otherwise, there is no other fruit which can be avoided. You can take all the fruits. Just the thing is, they should be cleaned properly, washed properly, and don't take chilled fruits nowadays because of COVID. We are afraid of any cold or URI. So just take fresh fruits and which are washed properly. So there is nothing other than papaya which you should avoid.
Thank you, ma'am. I'll just take one question now. Uzma is asking, I'm 36 weeks pregnant now. My due date is 28th May, but my doctor is telling me to go for planned C-section due to the COVID situation. I might not get a bed if I wait for normal delivery, but all my reports are normal. What should I do?
Actually, you have to see for this at your place. What is the situation? 36 weeks per se, we cannot say if it's your first pregnancy or you had a cesarean or two cesarean before. I don't know that, but you can wait till 37 if the doctor permits. But it all depends on you and your doctor's rapport and how the situations are there. But we generally recommend after 37 weeks, at least 37 weeks.
Thank you so much, ma'am. I think there are many more questions, but then I'll have to stop here because the time doesn't permit. To all the viewers whose questions we could not take up, we tried to do as many as we could. But if we missed it, please post it in the feed section, and one of our experts will revert within 24 hours. And please come back at 7:30 p.m. We will do a live breathing session, which you've been waiting for. Since last week. And to Dr. Pooja, thank you so much for doing the session with us. And our viewers are very, very thankful for the insights you shared on the COVID situation. We would love to have you back in our session soon. Yes.
I also enjoyed answering all the questions, and thank you very much. Thank you, iMumz app, for sharing all the information and spreading smiles on the pregnant women's faces. Thank you.
Thank you, everyone, and have a great evening.